First of all, welcome Sandhya. I know like some of our other distinguished guests, you have caught the red eye to come here. Thank you so much for this. And it's really important that we get what the money thinks in this arena. So a CFO soundbite will always be useful for us. I just want to extend, with you at Narayana Health, I want to actually extend the points that we touched upon a little earlier with Mr. Shiv Kumar and Mr. Rajat Gupta from McKinsey. It was essentially around the corporate role in this arena, which is the problem with sustainability is the wooliness of the term itself. You know, who doesn't want to be sustainable? Everyone says sustainable hona hai, but how to do it, how to ensure that we operationalize it well is the challenge. So if I could begin with actually based on your experience, what can ensure corporates get to view, this is something which I asked Mr. Shiv Kumar as well, how we view the climate investments less as a threat and more as an opportunity. I'm asking this more in the backdrop of the BRSR and others compulsions coming in now. But internally as an organization, to convert it from threat to an opportunity, are you able to do it, and how do we do it?
Sure. So first of all, I want to commend the initiative that you've put together, and I've been sitting in this session since it started, and each of the sessions are more a masterclass than content. So it was really very, very well orchestrated and well thought through. So congratulations for that.
Thank you so much.
And coming to your specific question, maybe I want to take a little case study of Narayana's journey. And that maybe amplifies this opportunity versus something that I have to do on the I also have to do kind of thing. So when we started with our BRSR journey, it became applicable to us a couple of years back. And when we started putting together the data for BRSR, we realized that should we really do this like a compliance exercise, just fill up that Excel sheet that BRSR wants and maybe put some processes in place that allows us to collect that data effectively. And then we realized that what does this really mean for us? What does Narayana stand for, and what is our purpose? And then from the beginning of our inception, our purpose was always health for all, which is that how do you make healthcare affordable, accessible and available for everyone. So then we went around the organization and we figured out how are we actually operationalizing health for all in the organization. And then we realized that we are a very cost efficient organization, so that we're doing a bunch of stuff around say renewable energy, around digitization, and I'll talk some of those examples a little later. Then that became like, okay, these are what I'm doing from a planet point of view. So our first goal became healthy planet. And then we built our entire strategy for environment around things we were already doing in the organization. Then we were always a socially leaning listed company. So there was a bunch of stuff we were doing on the social side. Then that became our social goals, which we were already doing. So that became our healthy society. And then we are known for a very high standard of governance. So that became our governance goals. But when we took that approach to see what we stand for and then build our ESG or sustainability journey around that, the best part was that we didn't have to do anything new. We just had to monitor or measure what we were doing well, create that awareness to people that what you're doing matters, and we were also able to create a motivation. So today when you walk into any of our unit leaders' cabins and they hang all these pictures around their awards and recognitions and stuff like that, all of them have something on sustainability. Because there was things that we were doing, which they were doing as a part of their business, and now they know that it aligns to the sustainability goal of the organization. It means something. So it becomes an opportunity when we are able to dial it back to the purpose of the organization, and we are able to bring to life what the organization does in our sustainability goals.
Yeah, actually, I think very important point. You said that you didn't have to do anything new. What you were doing, you had to only kind of monitor, measure, motivate. And it's money, making money available for all of this. What are the first steps that you took to, very briefly, I know it's a longish kind of a question, but to monitor, measure, motivate, all these are very difficult things to do. Yeah. Presume for an for a minute, an organization wanting to embark on this journey, what would be one or two things that you can very briefly at least say that,
Yeah. No, actually, I'll take a slightly long answer on this because it's important. As a finance person, we all look at business cases. Everything is business case, and we want to make money in everything. So any investment, what is the return? So when we started, some of the returns were low hanging. So, renewable energy, you put money today. I annualized save about 9 crores on renewable energy. 97% of our entire electricity consumption in Karnataka is from solar, wind and idle power. So we've been able to do that. So this is a straightforward business case. Maybe another straightforward...
But you can't replicate in any other state, right? Because again, that will vary, infrastructure will vary, right?
Yes, because the different state governments are at different levels of maturity, but it's a journey, and one of the speakers spoke about that. It's each of the states are realizing that they have to get there. And over a period of time, hopefully, other states will also create that enablement for us to be able to build that kind of capability. But it's a very straightforward business case we were able to do. The second was some capital decisions. So for example, when we were replacing a chiller, we will replace with an energy efficient chiller. We were able to do different types of interventions in our air conditioning, etc. Now those, you can't say one fine day, you can't say now I'm incurring like 100 crore of capex and going to renewable or going to energy efficient structure. When the cycle of capex comes, when my chiller need to be replaced, I will replace with an energy efficient chiller and stuff like that. So for us, every year we save about 4-5 crores just because of the decisions we make, and these are normal, typical business decisions. So that's not a problem. The problem comes in the business case where the numbers are little fuzzy. So let's take water. Now, intuitively, we know we have to save water. So we know what we need to do. We need to have energy efficient water systems. We need to have water recycling. We need to be able to address leakages, repair them on time. We intuitively know that. But when hospitals are extremely capex, large facilities, they have millions of taps. Now, if I have to go and fix, it's a huge capex investment. Now, will I be able to draw a business case to say, okay, I've invested so much on water efficiency capex and it is going to save so much money for me? Maybe, maybe not. So in those cases, we changed the measure. We said the measure will not be how much money gets saved because of water, but my kiloliter of water per occupied bed. Now, am I able to bring the kiloliter of water per occupied bed? Because I know that at some point in time, I am going to purchase water, and when I purchase expensive water, if I have the lowest kiloliter per occupied bed, I will be more efficient in terms of my operation. So that's how you justify the business case. Now, the last use case I want to talk about is where you want to change the strategic direction of your business with the environment measure. So for example, we took a goal saying, so typically any of you who visit a hospital, you will see that you will all carry pages and pages of reports, various reports. And when you go to a doctor, you have a 5 minutes appointment, and the doctor, you're expecting them to go through like thousands of pages of reports and tell you saying this is what's wrong with you. And we said, we see about 3 million patients a year. We were consuming 4 years back 21 pages per patient. Just imagine the amount of paper we were printing in our hospital. But while we can say it's an environmental goal, it's actually a digitization goal. Because when I digitize my organization, when I put all my records on the EMR, when I tell my patients, today you walk into our hospital in Bangalore, people get no paper. There is no bill, no prescription, everything is digitized, which means my entire business process has got digitized, which means my wait time has reduced. I'm able to fill my pharmacy better because I am able to do an AI-based prediction on what type of pharmacy demand comes. I'm able to keep ready my service orders for my customers when they come. I'm able to plan my radiology better because doctor is not writing an MRI and then patient walks up to the MRI counter. They put on the system, so even before the patient walks up to the MRI counter, I know the patient is coming. So it has, while it was an environmental goal of saving the number of pages I am printing, it has completely transformed the way I do business. So some of this business case can actually change at a strategic level how organizations work. So I think as finance people, we have to have that ability to see that business case and drive that jointly with the organization. Sorry, you asked for a short response, but I gave a very long answer.
No, we are happy with longish responses. We always pearls of pithy wisdom that we have to gather all along. But tell me, in this journey, one or two areas where you think there is scope to do more. What are unfinished agenda is a very vague term, but your immediate priorities, if you can touch upon that, I at least get a sense in terms of what perhaps could be on your mind right now.
So see, there is millions of things to do. Healthcare is one of the largest carbon emission. I think 4.4% of carbon emission happens from healthcare. And it is a very complex problem to solve. Multiple levels. One, it's extremely manpower intensive, which means that we have, for our hospital, we have 20,000 people working. 20,000 people are traveling, and it's not a work from home business. 20,000 people are traveling to work every day, and it is a carbon problem. We have a very heavy quality focus, so a lot of disposable. Healthcare generates a ton of waste, and a lot of it, like we talk about recycling, reuse, etc., there are very different recycling norms for healthcare because of the safety concerns that come with it. So the cost of recycling in healthcare is very, very heavy. So we are extremely environment unfriendly in that case, in that way. And healthcare also has a very heavy MSME footprint. A lot of our services are purchased through MSMEs, and therefore being able to implement. So for when I'm doing my scope 2, scope 3 journey right now, and my scope 3 journey is so complex because if I have to map out all my ecosystem costs, and how do I work with the entire ecosystem for my carbon emission reduction or my net zero goals, it's a very challenging task. So while whatever we are trying to do is really scratching the surface only. We have a very long journey as healthcare, not just in India but globally, to be able to bring down the footprint of emission that we are creating.
So any immediate priority over the next 6 months, 1 year, 2 years that you can, maybe one or 2 points?
No, I think the priority is just what we have to continue to do, which is one, we have to be very focused from an environment point of view. But more than priority, I want to talk about opportunity. Healthcare actually has a very big opportunity of being able to solve for sustainability in a very different way. Now, I'll give a couple of examples. One is the research that happens today. For example, there are organizations that are researching the epidemiology and environment. So, for example, last week I had met one research scientist. She is researching the impact of air pollution on pregnant women. So, there is a lot that healthcare, because many times and today every speaker was speaking about air quality in Delhi. And if you see, there is also one of the lung surgeons in Delhi was saying that he sees smokers' lungs in non-smokers. Now, all of this is actually resulting in a healthcare problem. So, there is a lot of role that healthcare can play through the research aspect of healthcare. So, that is one place which is also our priority. We are one of the largest clinical research organization in the country. So healthcare can play a very effective role. The second place where healthcare can play a role is in the talent paradigm. So when India is a very successful example of how the COVID vaccines were administered. One of the reasons why India could successfully deliver that was because of the way the government handled the talent paradigm of administering the vaccine. There was something called the e-win portal, where the government was able to digitally train a large workforce. So to be able to solve for sustainable outcomes, India has that ability, and healthcare has that ability to create that talent paradigm. That's another one. The third one is really awareness. I think there is an organization which is a group of pulmonologists, cardiologists, pediatricians. They've all come together and they are actually evangelizing what are healthy practices that people can sustainably practice for healthier lungs. Now, that also then goes into environment. Somebody was talking about you have to spend your money for, if you want to move into EV vehicles, you have to be willing to shell money. So these people are actually evangelizing the role you can play in bringing down carbon emission and why it's important for your lungs. So there's a huge evangelization healthcare place. So the opportunity really for healthcare is to participate in the sustainability goal of the country in a more holistic way, and we are doing a lot of other healthcare organizations are doing, but there is a lot that can be done.
Yeah, they're huge. I think including with the morning we touched upon biodiversity and diabetes. You mentioned about air pollution and pregnant women. I think there was a paper also on microplastics in placenta. Yeah. So I mean that seems to be one area. Yeah, very important areas. 2-3 quick points really. Now we've touched upon this earlier in our conversations about standards. So both global and local, and sometimes this seems to be an area where people seem to be concerned to monitor and measure sustainability. What's your view in terms of the standards which are there? Do you think they are good enough? Where do you need room for correction?
Sure. So I think it's a journey. The global standards are, of course, aligned to UN SDG, aligned to GRI, aligned to multiple KPIs, and there's a lot that has happened in that space. And I think Indian, like CRISIL, CARE, they've all come up with Indian standards, and to be fair to them, they are contextualizing to India. So there is a color for social, there is a color for water, there is a color for pollution. So they are contextualizing to India. But the real challenge with respect to all these standards is maybe 3-4 factors. One, of course, is that there is a lack of uniformity. The second is a lot of reliance is on self-reporting. We all know that there are a lot of mining companies, they actually selectively report data so that the sustainability numbers can look better. Now with BRSR core, etc., some of it will get strengthened, but there is still space to go. There is also opaqueness in the way these standards itself operate. So for example, for us, we are considered to be like the industry leaders in governance. We have a very high governance standard. You look at any of our analyst reports, we are rated very high on governance in the way we operate. My governance score on MSCI is below most of the healthcare organizations. So we wrote to MSCI saying, why is my governance score low? They said, you have a lot of income tax cases open. Which company in India does not have income tax cases open? Everyone, that is how the Indian system works. So there is a lot of non-understanding. I'm hoping that, say, with the Indian rating agencies coming, some of it will change, but there is a lot of opaqueness or inability to engage and communicate in some of these ratings. And there is also the problem of greenwashing. Some of the speakers spoke about it. It was interesting that Satyam was awarded the Golden Peacock in corporate governance maybe 6 months before the entire scam broke out. So that is the level at which, greenwashing can be managed.
And media reported it as well, which is we feel terrible about it.
And the final aspect, which I think is very, very important, is that for a country like India, environment is not the only goal. Social and governance is an equal goal. It is a developing nation. The country has to come forward, and the country has to be, we are still BBB rated. Governance is very important. So I think some of these rating agencies are excessively focusing on environment because it's measurable for them. It is easy to put on an Excel sheet. Social is not easy to put on an Excel sheet, or governance is not easy to put on an Excel sheet. We have to find that balance of how we are able to give that weightage, and that is when I think we will be able to create a sustainable standard also for our country.
So is the message therefore that BRSR is necessary but not sufficient?
Not enough. There is lot more to do. Yes.
Okay. 2 other points is, I would want to actually have the listeners here, and this is something which I touched upon with Mr. Kumar as well. In organizations that want to actually make a real difference on the ground, it's essentially getting an internal buy-in across organizations, honing talent, and listing out immediate priorities. How do you go about doing it?
Yeah. So one is that I think and this is the fault of a lot of finance people also, that we see ESG as a cost center. We don't see it as a strategic enabler. And we percolate that thinking across the organization. People look at it as a cost center. So most of the time, if you go into most organizations and look at it into their ESG theme, it will be underinvested in terms of talent, underinvested in terms of strategy, underinvested in terms of even visibility. How many times does the ESG head actually present to the board? Hardly, maybe once. There will be, of course, there will be a CSR committee, there will be a sustainability committee, and those are mandatory committees which get presented. But as a board agenda, this is my strategic priority. Hardly we have organizations coming and presenting to their leadership. So the starting point for organizations is to start looking at ESG as an embedded strategic enabler, and I spoke about the Narayana case study on that. The second aspect is being able to create that business case, and finance has to play that role. I explained the Narayana business case, but it was not like, we woke up one fine day and that business case came. It took us 2 years to actually build that business case and be able to create a model where I can stand today and say that my sustainability agenda makes business sense for me. I can stand in front of my investors and say, this is why it's important for me and this is why this is the right thing to do. But it takes that effort and investment and energy. And finally, I think we also, as a community, need to start, so when I go into when I talk to investors, etc., and I talk about sustainability, I talk about everything, they all go back to, and I think we have Ashwath Damodaran to unthank for this, is that they all talk about that's all fine, but how does it add to my beta multiple, or does it dilute my beta multiple? Now, if we are going to look at sustainability as a capitalistic thing and say, because you are sustainable, maybe, you are not the good organization to invest. If we look at it that way, or maybe someone is even better, but I don't care about what their sustainability scores are. If that is the investor behavior, then we're always going to struggle because we're always led by investors. There was a speaker who spoke about that there is a lot of fund available for sustainability. I'm telling you, there is no fund available for sustainability. Some green bonds are there. They come with lots of constraints and they are only available for certain sectors to do certain activity. There isn't enough money available for sustainable organizations, and it's a problem for us as a collective group to solve.
Yeah, I think lots to think about actually.
Thanks,
I'm just tempted. I don't know. I'm just trying to budge in. Since they have the benefit of Mr. Shiv Kumar also here. Do you, Mr. Shiv Kumar, any thoughts on what you've heard? I mean, you've looked at this subject very closely over the years, and the last point maybe that funds are available or not available. Any observation that you would have?
Certainly, there is a straitjacketing of where the funds are available for what kind of purpose. And those organizations which are already doing pioneering work will have to put efforts in shaping how these funds will think so that it moves into the right direction. So I agree with what Sandhya was saying that yes, it's not available for anything that you may want to do in the first instance. But different kinds of funds are willing to listen and then shape their own fund theories as to how do you put that in.
Okay, that's what you also think, yeah. That's great.
I agree. I agree. It's a journey though.
Yeah. Thanks so much. I think again the time's up thing is like a threatening thing on my head. So thanks so much for this.